Hey, I'm Joe Beck, and I discovered I had cataracts, which led me to Thomas Eye Group and Dr. Carlisle. So that was the beginning of what has turned into a wonderful experience. So I had discovered I had a cataract by accident. Basically, I was having some eye problems, starting to see halos at night when I was driving, and I drive a lot at night because I'm a DJ. And once that started getting to be a little bit annoying, and I discovered that one of my eyes was better than the other. And when I went to a regular eye doctor, they fitted me with glasses, and it worked for a little bit, and then it went away. The glasses were non-effective at all. So then after that, I discovered Dr. Carlisle and the Thomas Eye Group through my kids. We needed a eye doctor here in Georgia, and we brought the kids here, and they seemed to do a great job with the kids, so I decided to get my eye exam here. And once I did that, the staff discovered I had cataracts. So I got the cataracts, got it looked at, and total eye exam, and Dr. Carlisle recommended that I get a monovision correction, which is one eye seeing near and one eye seeing far. And once I did that, just decided I would go ahead and do it, and he did the surgery. It was amazing. I mean, the very next day after surgery, I turned my phone on, and the print was so big it almost like slapped me in the face. I was like, wait a minute. I said, my print, to myself, my print was this big? So I immediately decreased it. I was happy as all get out as far as that was concerned. And then he did the second eye after that, changing the near to the far. And it's worked out great ever since.
Mr. Beck and I talked about his needs in his day-to-day life for where he needed to be in focus and what he wanted his outcomes to be with his vocation and his work-related and hobbies and day-to-day activities. And we chose for him a monovision strategy where we intentionally set up one eye to see well at a distance and one eye to see up close. But even when you're choosing that focal point for the near, you want to have a conversation with the patient and get an idea of what their ideal focus point is or what their range is. And we can set that wherever the patient's needs are. We can bring it closer in for somebody that wants more detail, or we can move it further out for somebody who wants more of an arm's length focus that might suit their lifestyle or their day-to-day needs. But that's a conversation that I have with the patient and develop a feel for what's going to best suit them, or have them share with me how they use their eyes on their day-to-day life.
If I was to describe the experience, I would say miraculous. It was fantastic. I was very happy with the outcome. I had to get used to the monovision at first, but once my brain and my eyes got in sync, it was great. One of the things that I recommend for patients coming in, so I'm 60, and I don't know if other patients develop cataracts this early or not, but I recommend Dr. Carlisle just because not only did he do a great job of getting my vision to a place that I was happy about, but just the procedures just seemed to be second nature to him. He was very, very at ease. I say he was very skilled. There was no guesswork in what he did. It just was straight to the chase. He knew what he was doing. He explained it, and from my end of it, it appeared that everything that he explained worked flawlessly. It was perfect. So I was really happy about it. If you were a candidate for monovision or laser correction, I would highly recommend that you have it done and have Dr. Carlisle do it.